Not all psychological disorders begin in adulthood. Many start early in childhood and adolescence, quietly influencing attention, behavior, emotions, and social development. Children who are often labeled as difficult, disobedient, lazy, or different may actually be experiencing neurodevelopmental or behavioral disorders that require understanding, structure, and support rather than punishment or judgment. After studying severe mental illnesses and personality related disorders in the previous parts, we now shift our focus to disorders that emerge during early development and strongly shape behavior and learning. Welcome back, students. This is part 5 of the psychological disorder series. Today, we shall understand a group of disorders that actually begin in childhood and adolescence. These disorders mainly affect attention, behavior, social interaction, and overall development. We will begin with ADHD. ADHD, which is also commonly known as Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity. These symptoms are more severe than expected for the individual's developmental level and interfere with academic, social, and occupational functioning. ADHD usually appears in childhood, but symptoms often continue into adolescence and adulthood. There are 3 main symptom clusters in ADHD. First, inattention includes difficulty sustaining attention, careless mistakes, poor organization, forgetfulness, losing things easily, and difficulty following instructions. Hyperactivity includes excessive movement, restlessness, inability to sit still, excessive talking, and difficulty engaging in quiet activities. Impulsivity includes acting without thinking, interrupting others, difficulty waiting for turns, and making hasty decisions without considering consequences. ADHD is not caused by laziness or poor parenting. It is linked to differences in brain development and functioning. Next, we move on to conduct disorder. Conduct disorder is a serious behavioral disorder characterized by persistent patterns of behavior that violate social norms, rules, and the basic rights of others. It usually appears in childhood or adolescence and is more severe than normal behavior. Individuals with conduct disorder may show aggression towards people or animals, destruction of property, deceitfulness, theft, and serious violations of rules such as truancy or running away from home. These behaviors are repetitive and intentional, not accidental. Conduct disorder is associated with poor impulse control, lack of empathy, and difficulty following authority. If untreated, conduct disorder may increase the risk of antisocial personality disorder in adulthood. Next, oppositional defiant disorder, ODD. It is a behavioral disorder characterized by a persistent pattern of angry, defiant, and argumentative behavior towards authoritative figures. Unlike conduct disorder, ODD does not involve serious violations of others' rights or criminal behavior. Common features include frequent temper tantrums, arguing with adults, refusing to follow rules, deliberately annoying others, blaming others for mistakes, and being easily irritated. Children with ODD often appear hostile and resentful but may behave well with peers. ODD is usually diagnosed in early childhood and may progress into conduct disorder if not managed properly. Now, let us understand autism spectrum disorder, ASD. Autism disorder that affects communication, social interaction, and behavior is a neurodevelopmental disorder. It is called a spectrum because symptoms may vary in severity and presentation among individuals. Autism usually appears in early childhood and continues throughout life. Major symptoms of autism spectrum disorder. First one, social deficits. Individuals with autism show difficulty in social interaction and social communication. They may struggle with eye contact, facial expressions, understanding social cues, sharing emotions, and forming relationships. Social interaction often appears limited or unusual. Second, absent or delayed speech. Some individuals with autism disorder have delayed speech development. They may or may not develop speech at all. Others may speak but have difficulty using language for social communication. Speech may be repetitive, monotone, or lacking conversational reciprocity. Third, self-stimulation, which is also known as stimming. Self-stimulatory behaviors are repetitive movements or sounds used to regulate emotions or sensory input. Examples include hand flapping, rocking, spinning objects, repeating words, or tapping. These behaviors help individuals cope with stress or sensory overload. Intellectual ability. Intellectual functioning in autism varies widely. Some individuals have intellectual disability while others have average or above average intelligence. Many show uneven skill development, excelling in certain areas while struggling in others. Need for sameness. Individuals with autism often show a strong preference or routines for sameness. They may become distressed by changes in environment, schedule, or routine. Repetitive behaviors and restricted interests provide a sense of predictability and comfort. Now students, let us understand eating disorders. Eating disorders and substance abuse disorders are serious psychological conditions that deeply affect person's physical health, emotional well-being, behavior, and social life. These disorders are not about weakness or lack of willpower, they are complex mental health conditions, influenced by biological, psychological, and social factors. Understanding them is important because early awareness can prevent long-term damage and even save lives. Let us begin. Eating disorders are psychological disorders characterized by disturbed eating behaviors, unhealthy attitudes towards food, body weight, and body image. Individuals with eating disorders often develop an intense fear of gaining weight, a distorted perception of their body, and unhealthy methods to control their weight. These disorders commonly begin during adolescence or early adulthood but can occur at any age. One of the most well-known eating disorder is anorexia nervosa. Anorexia nervosa is a serious and potentially life-threatening eating disorder in which a person has an intense fear of gaining weight even when they are underweight. Individuals with anorexia see themselves as overweight despite being dangerously thin. Because of this distorted body image, they restrict their food intake severely. People with anorexia may skip meals, eat extremely small portions, count calories obsessively, or follow rigid food rules. Some may exercise excessively to burn calories over time. This severe restriction leads to extreme weight loss, weakness, dizziness, hair loss, dry skin, and hormonal disturbances. In females, menstrual cycles may stop, and in severe cases, organ failure can occur. Psychologically, individuals with anorexia often struggle with perfectionism, low self-esteem, anxiety, and a strong need for control. Food and weight become a way to cope with emotional pain. Without treatment, anorexia has one of the highest mortality rates among mental disorders, making early intervention essential. Now, let us move on to another eating disorder, bulimia nervosa. Bulimia nervosa is characterized by a cycle of binge eating followed by compensatory behaviors to prevent weight gain. During a binge episode, a person eats an unusually large amount of food in a short period of time and feels a loss of control while eating. This is followed by intense guilt, shame, and fear of weight gain. To compensate, individuals may induce vomiting, misuse laxatives, or fast for long periods, or exercise excessively. Unlike anorexia, people with bulimia often maintain a normal or near normal body weight, which makes the disorder harder to detect. Bulimia can cause serious physical complications such as sore throat, damaged teeth due to stomach acid, swollen salivary glands, dehydration, electrolyte imbalance, and heart problems. Emotionally, individuals with bulimia often experience depression, anxiety, and feelings of worthlessness. The cycle of binge eating and purging becomes a way of temporary relief for their emotional stress, but it ultimately increases psychological distress. Both anorexia nervosa and bulimia nervosa require professional treatment that includes psychological therapy, nutritional rehabilitation, and emotional support. Now, let us shift our focus to substance abuse disorders. Substance abuse disorders, also known as substance use disorders, involve the repeated and harmful use of psychoactive substances that affect the brain and behavior. These substances alter mood, thinking, perception, and consciousness. Over time, the individuals may become unable to control their use despite knowing the harmful consequences. Substance abuse disorders develop gradually. What may start as casual or experimental use can turn into regular use, dependence, and addiction. Factors such as peer pressure, stress, trauma, curiosity, availability of substances, and genetic vulnerability may play a significant role. One of the most common substance abuse disorders is alcohol abuse and dependence. Alcohol abuse refers to the excessive or harmful consumption of alcohol that leads to problems in health, relationships, work, or studies. Individuals may drink frequently, binge drink, or use alcohol as a way to cope with stress, anxiety, or emotional pain. Alcohol dependence, also known as alcoholism, occurs when a person becomes physically and psychologically dependent on alcohol. They develop tolerance, meaning they need more alcohol to achieve the same effect, and experience withdrawal symptoms such as shaking, sweating, nausea, anxiety, or irritability when they stop drinking. Long-term alcohol use damages the liver, brain, heart, and digestive system. It also increases the risk of accidents, violence, and mental health problems such as depression. Despite these consequences, dependent individuals find it extremely difficult to stop drinking without help. Now, let us talk about narcotics. Narcotics, also called opioids, are substances that reduce pain and produce feelings of relaxation and euphoria. Examples include heroin, morphine, codeine, and certain prescription painkillers. While these drugs are medically useful when prescribed, misuse can lead to addiction. Narcotic abuse disorder can cause intense pleasure initially, but repeated use quickly leads to dependence. The body adapts to the drug, and stopping it suddenly causes severe withdrawal symptoms such as muscle pain, vomiting, diarrhea, sweating, and intense cravings. Narcotic addiction can destroy a person's physical health, leading to respiratory damage, depression, infections, and even death from overdose. Socially, it can result in broken relationships, financial problems, and criminal behavior. Recovery requires medical supervision, counseling, and long-term support. Now, let us talk about tranquilizers. Tranquilizers, also known as sedatives or depressants, are drugs that slow down the central nervous system. They are often prescribed to reduce anxiety, induce sleep, or relax muscles. Examples include benzodiazepines and sleeping pills. When used without medical supervision for long periods, tranquilizers can cause dependence. Individuals may begin to rely on these drugs to handle everyday stress or sleep, gradually increasing the dose. Abuse of tranquilizers lead to drowsiness, poor coordination, memory problems, and slowed breathing. Withdrawal can cause severe anxiety, insomnia, tremors, and in extreme cases, seizures. Because of these risks, tranquilizers should always be used cautiously and under medical guidance. Finally, let's talk about stimulants. Stimulants are substances that increase alertness, energy, attention, and activity in the brain. Common examples include caffeine, nicotine, cocaine, amphetamines, and certain medications used to treat ADHD. While stimulants may initially improve focus and energy, misuse can lead to serious problems. People may abuse stimulants to stay awake, enhance performance, or feel confident and powerful. Stimulant abuse can cause restlessness, anxiety, insomnia, increased heart rate, high blood pressure, and paranoia. In severe cases, it can lead to hallucinations, aggressions, and heart failure. Dependence develops when individuals feel unable to function without the drug. Let me conclude, students. Eating disorders and substance abuse disorders are not only lifestyle choices, they are serious mental health conditions that require understanding, compassion, and professional care. These disorders often develop as unhealthy coping mechanisms for emotional pain, stress, or trauma. Recovery is possible, but it begins with awareness and acceptance. Early identification, supportive relationships, psychological therapy, and medical treatment can help individuals regain control over their lives. If you or someone around you is struggling with disordered eating or substance abuse, remember that help is available. Reaching out is not a sign of weakness, it is a sign of strength. Talk to a trusted person, seek professional support, and choose healing over silence. Mental health matters, understanding saves lives, and recovery begins with one brave step forward. Recovery is not instant, but it is real. Let us choose kindness over stigma, understanding over ignorance, and action over silence. Because mental health education does not just inform minds, it saves lives. You are not broken, you are not alone, and help is always possible. Encourage people who are suffering from psychological disorders. Listen to them, don't judge them, support them. And if this content helped you understand psychological disorders deeply, share it with someone who might need it. Stay curious, stay compassionate, and remember, healing begins with awareness.